Welcome to BoCo Summit, the Rural Broadband Technology Solutions Summit 2018. We wish to thank our sponsors for helping to create a path for fast, affordable connections. This BoCo Summit session is entitled Healthcare for the Masses, the Promise of Technology, with Brandon Evans. He is a Botetourt County Broadband Advisory Commission member and a director at Friendship.
We're going to have Brandon Evans come up, and there's a correction that needs to be made in your program. Brandon is a member of the Botetourt County Broadband Advisory Commission. That has not changed. He has recently changed employment. So we're glad he's still here with us and that he was able to make it even with his new job duties. Because of Brandon, we also are lucky to have the Glebe as a sponsor. And thank you, Brandon, and thanks to the Glebe. They've been tremendous, and we have continental breakfast tomorrow morning because of them. And we also welcome you on your new duties over at Friendship. And we're excited to hear about the health aspect. Thank you.
Thank you, Arlene. Like Walter, I would like to take a minute to just explain how I ended up here. And sometimes I find myself asking myself that question almost on a daily basis. I was asked to participate in the Broadband Commission mainly because I'm a geek. I'm a nurse. That's what I've went through my college education to do. But I really enjoy learning about technology, and I found myself in a situation in which it became even more important to me. And you guys are good. I'll keep on speaking here. I'm also a dad. I have a 9-year-old son. His name's Hunter. He is a typically developing kid. He is into everything, and he really keeps me on my toes. But I also have a 5-year-old son who has cerebral palsy. I'll put his picture up here, you guys. Hopefully you guys can see that okay. So as a nurse and as a dad, I wanted to be able to care for my kids with anything that they need, as we all do as parents. And for my 9-year-old, it came pretty easy. For him, a Band-Aid fixed everything. For my 5-year-old Holden, he is slightly different. He was diagnosed as having cerebral palsy at the age of 1, which is pretty unusual. Typically, the diagnosis age for that is 2 years old. The poster here is a spinoff of the Addie Grace YMCA playground, and they asked us to put together some information on him because he will now get to enjoy that. So as a county, Botetourt helped with that need so that both of my children will eventually be able to play on the same playground. Holden's needs are completely different. He goes to UVA for most of all of his medical care. So as of February, we found ourselves in a situation where he developed what we thought was just a tremor. It was really the indication of him having seizures. We didn't know what it was at first. We consulted with his team here locally, went to UVA. They did an EEG and diagnosed him as having seizures. As a parent, of course, it was pretty scary. But we have a great team, great support system. The downfall is if his hand starts shaking, it's hour and a half to UVA, and his team can't always be there with him. So we have become we're reliant on telemedicine, teledoc. Right now, we can connect and speak with his physician over at UVA, who specializes in cerebral palsy and neurology, and they are able to tell us at that moment what to do. As Arlene mentioned, I have a separate passion for my children, which is my line of work. I'm a nurse. I provide care to geriatrics at the Glebe. The Glebe is a local continuing care retirement community. They have independent living, assisted living, nursing home care. I just started at Friendship South facility today, which is all long-term care. And, you know, that atmosphere is changing. We call it in the industry a silver tsunami that is coming. By the year 2030, there will be 20% of our population that's the age of 66 and older. I won't ask how many of those folks are in this room today, but it's a large number, and it presents a challenge for healthcare, because not only is that age group 20%, it's taking up the majority of the population, but a large portion of the caregivers are now retiring as well. And we're seeing that already. We saw that with some of the healthcare reform that's happened. I don't know how many of you all are able to just call and say, I want to see my physician. Most of the time it's now nurse practitioners and PAs. And that movement is continuing to grow. And quite frankly, there's great concern in the industry regarding how we are going to be able to meet that need. And if you're in this age group and you found yourself in this situation, or you have someone that you've helped and found yourself in this situation, you know that if you receive Medicare or Medicare replacement policy, if you need additional care after a hospitalization, you really only have 4 choices. And in this area, there's limited, there are probably just 3 for Botetourt. There's a long-term care hospital. Last year, there were 116,000 people that participated in that. There were patients in a long-term care hospital. It costs the federal government, CMS, $5.3 billion. One of the other options is an inpatient rehab facility. That's for the folks who really need to be in the hospital. There were 334,000 people who were a patient last year, and that cost our taxpayers $7.4 billion. So those 2 options really, for the majority of the cases, aren't on the table. So it leaves with 2 more, which is a home health organization and a skilled nursing facility. Most people, given the option, want to go home. None of us want to be in a skilled nursing facility. The interesting part is that last year there were 3.5 million patients from a home health agency. It cost us $18.1 billion. As opposed to a skilled nursing facility, which is 1.7 million, which is about half of that, and it costs $29.8 billion. So it's basically twice as costly, if not more, for folks to transfer from a hospital setting to a skilled nursing facility. So the desire and the push right now from our government is to see if we can get folks home sooner, right? Most people are looking at, and the payment structures are changing next year to where they want people to be in a skilled nursing facility no greater than 20 days. So there's going to be more of a desire to be at home to receive those services, not to mention the other side effects that happen when you're in a long-term care facility or a hospital. You're more apt to receive infections that are pretty nasty. So in Botetourt County, how does that translate? In Botetourt County, the baby boomer generation is 8% higher than the national population by density. So you take that into effect and you look at the rural nature of the county. We have a health need. How are we going to care for these folks that are going to be in their home? The great thing is technology can help. There are, I'm researching this for my son Holden. There are helmets that can be worn that can do EEGs on the spot. They can send that to a physician. How many people have a wearable health device like a Fitbit or anything like that? How many people get their steps in? Okay, you don't have to raise your hand on that. So there's wearable technology. A lot of folks are wearing Holter monitors to check for EKGs that are at risk for heart attacks. I've been doing some research on some companies to where it's so simple to where you can put a device in your commode to where when you use the bathroom every day, it analyzes it and can send it to your physician. So the technology is there. Not saying it's going to replace a physician, but it's there. And we have to be ready for that. We have to be ready for that as a county and as an organization. And, for me, I think that, just looking at how I would like to be and how most people in this room would like to be, I would much rather have that in my home setting. There's just so many better applications for that. And, for Botetourt County, we're going to have a panel coming up that's going to talk a little bit more about that. But every person that has spoke up to this point has really looked at the business of this, and it is a business. We do have to provide services, and there are costs associated with it. But I'd like to implore folks to look at the health aspect of it. I think, looking at our kids that are going to be there providing the care for us as we get older. And in some cases, like for me, when I'm going to be needing care and I'm going to have Holden that's going to be somewhere else, that's one of the things that I look at every day. So I'd like to implore the folks here that are looking at things to look at the health benefits associated with it. Does anybody have any questions for me pertaining to the health? Yes.
What was the name of telemedicine?
Telemedicine, like Teledoc. It's also a cheaper option. I know for me with my health plan, if I see my physician, there's typically a $40 copay at best. So that's being utilized, and it works. Fortunately for the section of Botetourt that I live in, we have great connectivity. So for me, it's a seamless connection. There's a lot of things out there with like the Google glasses. I saw a case where EMS was wearing the Google glasses. They were able to teleconference with a physician. They could see everything that was happening with the patient. By the time the patient made it to the hospital, they had a CT lined up. As soon as the CT came in, the doc had telemedicine right to the neurologist and looked at it and was able to treat that person with a clot blocking agent within 10 minutes of heading to the hospital versus even a 45-minute wait to the CAT scan. All right. Any other
And all
questions?
of this really relies on high media-rich content.
Absolutely.
Video and
Yeah. Not to make light, but for Holden's example, it's hard to tell if he's shaking if the screen's pixelated and he's moving back and forth. It has to be real time fast. And fortunately for him, we have that, but there's so many folks in the county that don't.
and really predicting future demand for broadband needs relative to the silver tsunami.
Well, exactly. And so Forbes magazine, for example, listed Roanoke as one of the top 25 nations to retire in the country. And as Ken mentioned earlier, Botetourt's outgrown Roanoke. And so those folks are going to be moving into the county, and so the demand in Botetourt County is going to increase. You're exactly right.
Now we want to hear from you. Email us bocosummit@botetourtva.gov. Engage with us on our journey. We give a special thanks to our community volunteers, and special thanks goes to these organizations. Again, thank you, our sponsors, for helping us to create a path for fast, affordable connections. BoCo Summit, the Rural Broadband Technology Solutions Summit, is presented by Botetourt County of Virginia.